Hello, I'm Dr. Sundari Mase, Sonoma County's Public Health Officer, and I'm here to share the latest updates on coronavirus here in Sonoma County. As of April 14th, there are 152 confirmed cases. That's 5 new cases since yesterday. 81 of them are active, and 69 have recovered. We do have 2 deaths, and we've done a total of 3,768 tests. Today, I want to talk about the new health order that I issued yesterday that requires the general public to wear a facial covering when they are away from home in certain circumstances. So this is something that I know many people are already doing. So I'm certain that this is going to become the new norm in the community. So here's the basics of the order. I would like to have people wear a facial covering when they enter any indoor facility, a business such as a grocery store, or if they go into any enclosed space. And people must also wear a facial covering even when they're outside if they feel that social distancing is not possible and they can't stay more than 6 feet away from other persons. Now, this order also states that employers of essential businesses have to make sure that their employees who come to work are wearing facial coverings. So they can do this by providing facial coverings, ensuring that their employees have access to facial coverings, or that their employees are bringing their own facial coverings in when they come to work. And doing all of this is going to help protect all of us, specifically our community here in Sonoma County. Now, I also want to briefly address the antibody testing. It's a blood test that many of you have been asking questions about. First of all, these tests are really important, and they will help us in our recovery efforts. These tests will allow us to tell if somebody has been infected with coronavirus. Now, these tests hopefully will be available to us here locally. And these tests, in conjunction with the contact tracing that we're doing and the isolation of the cases and quarantine of contacts, will be key factors in keeping that community transmission down. I also want to underscore the importance of shelter in place. Shelter in place means that you should really stay home except for any essential activities or to leave for any essential business or essential travel. So the number one thing we can do now is to continue sheltering in place, social and physical distancing, and to wear the facial covering in the instances to which the order applies. Now, we do have a question for the day. There's a lot of discussion at the state and national level about plans to loosen shelter-in-place orders and to reopen the economy. And people want to know if I can speak to what the county is doing to plan for this. So our first priority is to continue these practices, especially the mitigating factors that right now are saving lives, like the shelter in place. We are, however, evaluating how we can start looking at different ways in which we can loosen up on shelter in place, maybe by doing a phased lifting approach systematically to make sure that we allow people to slowly do more things while we're still protecting our community. So we'll look at one of the critical indicators we'll look at is for a sustained reduction in our new cases. That will be an indicator that we're ready to start loosening some of our shelter-in-place measures. We're also working very closely with the other Bay Area counties and our state government, and also responding to what we're seeing here specifically in Sonoma County. So we need to stay vigilant. We know that the coronavirus is out there and is infecting people. We are always planning for tomorrow, however, and we will look at ways in which we can loosen shelter in place, keep evaluating how this loosening impacts our cases. And right now, I would advise people continue to follow the shelter in place order, the facial covering order, and stay safe at home, except for essential activities. Thanks so much for joining, and we will be back with you tomorrow. Oh, and lastly, join me tonight in the town hall, where we'll address more of your questions live.